Further debate? Recognize the member from Oshawa.
Thank you very much, Speaker, and I am pleased to be able to add my voice and some of the voices from folks in my community as we are discussing the need to further the period of emergency, which can only be extended by us here in this House, which is why we're having this debate. Certainly, I am not debating the fact that there is indeed an emergency in the province. But what I'd like to take the opportunity to do is focus on some of the ways that we could improve measures, actions that we could be taking to ensure that we diminish the spread of COVID-19, that we support those who are on the front lines, that we hear the voices of folks across communities who are indeed struggling or who are sick, who are trying to stay well, or those who are grieving their loved ones who have died of COVID-19. So we're here having this conversation today. We look back at recent decisions that the government had made. Let's take us back to that, now I'll say infamous weekend, but on that Friday, April 16th, when the government had announced a series of measures that didn't seem to reflect the advice from the government science table. Some of those measures had been needed to be walked back, that police officers and other provincial offences officers are given an authority to require any individual to provide their home address and purpose for not being at their residence. The police said, we don't want this power. And I can't assume what the government thought in that moment, but I imagine that they were, or the Premier was probably quite surprised to see that the police rejected that. But that speaks to where was the need for this and where was the drive coming from. How are decisions made, on the government benches or in cabinet? In the afternoon, the government said that they would revise that statement. Everyone was up in arms, understandably, about the restrictions on parks for families and folks, and really anything that we've heard from the scientists, from the advisory table about outside versus inside, about how this virus spreads. We would like to have more reassurance from this government that they are indeed listening to the advice of those who are qualified to give it, frankly. And they're, when we're looking at vaccination, and earlier today, was it today or was it yesterday? I'm losing track of days. They're all blending together because we're all so busy and trying to keep up. But the conversation in Bill 283 about vaccinations, data collection, there should be strategic targeting of communities at risk. We had talked about the need, and we didn't see it in the bill, which is now passed, but we didn't see it in the bill to collect race-based data. Now, I'll say that if you don't measure, then yes, I guess the government, if they're not measuring and they don't have to point to a measured need, then they don't have to come up with a targeted intervention to fix it. When we look at communities with racialized community members, essential workers who are getting COVID at higher rates, and we see that when we look at our ICUs, we see that when we hear from healthcare professionals, we see that. But we're not measuring it. And this bill that talks about the need to collect data and report data, no argument here on that as a goal. But to be specific so that we can have targeted interventions and make sure that those hotspots, the communities at risk and at need, get what it is that they need and deserve to keep themselves, their families, and the broader community safe from the spread. So that's a way that the government could easily improve things, is to start collecting that race-based data. And we did hear some talk of it in debate, but we didn't see it in the legislation. And a lot of it is the just trust us, wait till regulations. So I hope that we do see it there, because that has to. That has to happen in order to address the needs in the community. But healthcare priorities. We've talked about paid sick days. We need what is recommended. If it's during a pandemic, the NDP has said 14 days during it, and when there's an infectious disease. That's what is needed for the isolation. That's what's recommended. It takes longer than the 3 days this government has brought forward. It takes longer than that for some people to get their tests. So we need, again, for the intervention or the strategy to meet the need. We should have workers have paid time off to get a vaccine, and we've had conversations in here around some employers that are good about it and some that are garbage about letting their employees go to get vaccines. We're hearing case-by-case basis that an employer will tell someone not to, that they can't leave their shift or to reschedule their vaccine appointment, and that is allowed to happen. Though I would say, no one in this room wants that to happen. I see the Minister of Labour. There's no way that he wants that to be the case in workplaces, but it's happening. And anything that we can do to protect essential workers, we have to. And we have to anticipate that there are going to be situations like that where workers don't have what they need. We've spoken at length about paid sick days. I'm on the record about that, so I won't belabor that today, but that is a missing piece to this puzzle to keep people well. The shutdown of non-essential workplaces. As the critic for infrastructure, transportation, and highways, I took a careful look at that list of construction sites and construction workplaces that were deemed essential and didn't have to close. And there are a lot of questions about those lists, and that's, the government is getting criticism about that to try and justify it, because a lot of it looks like the decisions were not driven by the advice from medical experts. So, perhaps the government can better answer that. And we also keep hearing over and over that one of the ways that this government has not intentionally failed, but is supporting small business. And I say not intentionally failed because the program for the Ontario Small Business Support Grants, everyone in this room was grateful to hear that many of their small businesses were applying for and being accepted, and that they were being promised money. And I feel like every single MPP in this House, I think it's all parties, because we have been talking about it, have businesses that have yet to receive their first payment or have some sort of weird, complicating issue that should have been resolved how many months later. So we've had the minister, we've had the associate minister, we've had folks explain that they've hired more people to deal with it. And I will tell you, honestly, that when I checked in with my staff to find out before this debate if all of those same businesses that had reached out to us a month or two ago and hadn't received their money, had any of them gotten their payments? Were they all still in limbo? Some are still in limbo. Some have received their money. Some have gotten both payments at once. And some are relieved that they're getting a call back when they hadn't been. So it had been silence for weeks. So there's still a mix, but more and more of the businesses in my community are at least able to reach a real live human, or my office is able to connect them. So, for me to say, okay, we're working in the right direction, those businesses still can't wait for that money. So that's something that I don't know what went wrong. And, I'm not going to pick a fight with the government House Leader around fax machines or landlines. I won't be the one to do it. But I will say that there still is a communications breakdown, because if MPPs' offices, regardless of stripe, are unable to reach the ministry liaison folks or not able to connect with people to try and solve these problems, we're still having a communications breakdown. So I'm not saying to hook up the fax machines, but maybe the occasional phone could be plugged back in so that we could reach them. I don't know, but. And I don't mean to mock it, but I do want to highlight that these businesses are still in limbo, and they don't have answers for the bill collectors. There's a business in my riding, Hair Candy. She is still, unfortunately, still waiting for her first payment of $10,000, but she got a letter that says, thank you for submitting your application for the Ontario Small Business Support Grant. As you know, your application was approved under the business category, personal services, and you have received an OSBSG payment. No, she hasn't, Speaker. And this was to tell her that the province of Ontario is currently in the process of a post-payment audit of applications that have previously received OSBSG funding. So she was audited for money that they told her she got, but she has not, right? Which is not comical, but it's more than trying the patience there. Like none of it makes sense. And unfortunately, there are still businesses left behind. Here's a residential contractor that was never eligible for the OSBSG. And he had reached out to our office, and we've kept him in the loop with the work that our office has been doing. But he said, this program has upset me from the beginning. It seems to include every other business that offers services to people required to shut down, except small contractors, painters, tillers, etc. I noticed that the Ontario application website now specifically states it excludes those groups. I really don't understand why. My business has been shut down for the 3rd time. I'm a small residential contractor. I have leases on commercial vehicles, tools, and a space to store them. I do qualify for the CERB. It is $2,000 a month. My house mortgage is $1,500, so the cost of running my home is more than $2,000 a month. I also have 2 dependents in university, so clearly the CERB can't support my household. On top of that, I have the cost of my business, leases, insurance, etc. I just keep running further into debt. I just don't understand why we are specifically excluded for the grant. You know, there are folks out there that don't see themselves reflected in any of the legislation we've brought forward or the initiatives. I'm going to switch gears here, and I'm going to make this differently personal. This is from a community member named Joannie. And Joannie, from time to time, sends me direct messages on Twitter. So Joannie spends a lot of time online trying to make sense of the pandemic, following along at home, and hoping to see interventions that will help her in her day-to-day. So Joannie, and I'm sorry, I said she was from my community. No, she's not, Speaker. In fact, I'll read, "Thank you from Windsor for raising up about ODSP and OW. Please tell the Premier and the rest of the government that people are suffering. We were given $100 pandemic pay last May, June, July. That was cancelled by the PC government in July of 2020. The rising prices in food, no PPE, no cleaning supplies makes it very difficult. I'm on a special diet that I cannot even follow. With cancelled surgeries, my surgeries and procedures are put on hold once again. I'm physically disabled and a cancer patient and so frustrated. I've had to have Instacart since March 13, 2020. I desperately need masks, the blue kind, and cleaning supplies, but cannot afford this. I don't want to die." Sorry, this is real. I don't want to die. I would like to see more years of my life. But the government believes in MAID over social supports. When Mr. Ford gets angry at people, he forgets there are so many people like me and their families being so careful because if we, the disabled or immune compromised, get COVID, we will be dead. I've watched both levels of government every day since day one, and we are continually forgotten. What is the government going to do with all the people who have had COVID and now are coming out with long-term disabilities? We have been living below the poverty line for years, 40% below the poverty line. It's unfair and inhumane the way we have been treated. It's difficult to know their forms don't include different diets for all people with disabilities. I'm asking you as an Ontarian to just care. Please care. Please redo your budget, allowing people with disabilities the dignity to have healthy food, pay bills on time, purchase meds not covered, buy PPE, buy cleaning supplies each month. COVID didn't stop in July of 2020. You're letting us suffer so much. I am fighting to live. I pray for Ontario every day. I pray for every party every day. Please stop policing the most vulnerable and let us live. I don't know how much time I have. I just want to live not worrying every single day. I know you know all of this, but there must be a way to stop Ford from doing this. Please help people with disabilities living below the poverty line, please. Thank you and the NDP for your continued hard work. I'm so grateful. And that's from someone that I've never met, but I hope to. Her name is Joannie. She's in Windsor. And I hope that she can stay safe. Speaker, I'm always glad to share letters from community members, but sometimes it's really challenging. I have another letter here, and this is from someone who has signed it as a concerned daughter of a mother in long-term care. And she said that she is writing about the recent announcement the government has made regarding transferring patients from the hospital to long-term care. Oh. Sorry. Okay. I'm going to paraphrase for this first bit. Regarding transferring patients from the hospital to long-term care or a retirement residence to free up hospital space. And she has concerns, and she's reached out to my office. She says, quote, I have a parent in Hillsdale Estates, and they are already short-staffed, as I am sure they all are. So I am very concerned how they will be able to care for the vulnerable residents already there with not enough staff, and then add to this problem. Once again, nothing has been done to protect our most vulnerable, and I'm very concerned. The problem needs to be fixed, as Bonnie Lisick said, not added to, and this will definitely make things worse. Please speak up on behalf of our seniors. They've been ignored far too long. And that is from Lynn, who is a concerned daughter of a mother in long-term care. And that was in response to the recent Auditor General's report on long-term care, and that was before the Long-Term Care Commission came out. And as we've talked about in this House, the Premier has yet to comment. Not to split hairs around who owes what apology and who will or won't take responsibility for what. The people of Ontario need to know that there is leadership in this space, in this place, that is sincere and wanting to keep people safe and well, and that is willing to hold themselves to account as needed, or agencies. When the priority of this government has been to protect the for-profits or if that's how it's perceived, that's a problem. Ontarians, we hear the government say all the time that they have people's backs, but people don't see that, they don't feel that. Living in the Durham region with Orchard Villa and the terrible tragedy, and a lot of people are marking the one-year anniversary since their loved one passed. From that, I've been doing work with families and will continue to hold this government to account, but really to change the framework and the system to allow for accountability. When we look at the Long-Term Care Commission, there are a number of recommendations, 85, and some of them are specifically around accountability. And I really do hope that the government takes a careful look at that section, and others, but that section in particular, to make sure that if things go sideways, that someone is not only held to account, but that it's fixed and that it can be prevented. I'm working on private members' legislation that is pretty finicky and pretty, tight in the weeds there, but to fix some of these gaps and loopholes. On a large scale, we need people to take responsibility. The Minister of long-term care, when she said this morning that she took responsibility for keeping people well or for the health and wellness, she did not say that she takes responsibility for the death and destruction or for the suffering and devastation. And I think that families need to know that this government acknowledges that that happened and that someone should be responsible. Speaker, I've talked about sick leave, talked about the need for...
I'm sorry to interrupt the member from Oshawa. The clock being at 6 o'clock, it's time to move on to private members' public business, orders of the day.
Ballot item number 80, Mr. Gill.
The ballot item having not been moved, orders of the day.
Thank you, Speaker. Government Notice of Motion 109.
Resuming the debate, Government Notice number 109, resuming the debate adjourned earlier today.
Back to the member from Oshawa.
I appreciate that. Okay, so a minute and a half. There is so much to say, and it surprises no one that I have gone a little long in my remarks. I do have other things I'd like to share from the community, but I think that everybody is well aware of what they're hearing through their inboxes or their fax machines or their phones. We are hearing from people that we didn't get here by accident in terms of the history of long-term care and not supporting our healthcare system the way we should, but we have a chance now to fix it. This government needs to really ensure that it is listening to the health experts, that their decisions are not based on profit margins, that they're based on patient and people, their care and wellness. You know, when I look in Oshawa and Lakeridge Health, they're doing a tremendous job. We used to be the hospital that was receiving other, other transfers from other hospitals, and now our ICUs are such that, and our capacity issues are such that we're now sending patients to Kingston and Ottawa, and this is happening all over. So we do have to stop the spread in the community, look at things like paid sick days, not just look at them, really invest, commit to it. Protecting workers, ensuring that people have access to vaccinations. And Speaker, now I will sit down on purpose, and thank you for this time.
Thank you.